Welcome back to News Across Nigeria, where we tell you what's happening now across the Nigerian Federation. Before we continue, we'd like to remind you that all our top stories can be found on our website, and that's channelstv.com, and on youtube.com/channelsweb. Do visit m.channelstv.com to view us live on your mobile device. You can also download the Channels TV app for Android, iOS, and Windows phones from their respective stores. We'd also like to encourage you to use the Eyewitness feature in the Channels TV app. If you have pictures or videos you'd like to share with us, tap the application on your device, swipe to reveal the Eyewitness menu, and follow the instructions. The federal government is working to attract private sector investment in infrastructure development in the economy. During an interview, the Minister of Finance, Mrs. Kemi Adeosun, stated that infrastructure investment will drive down the cost of local production.
What are the reasons why, if the local is more expensive, what's making them more expensive? And usually it's the infrastructure costs, and that's what the government is trying to address with the budget. Because if I'm just inefficient and expensive, then it's unfair for us to say you must buy local. If local is double the price of imported, it doesn't make any sense. So what we've got to do is look at what are the issues around competitiveness that are making local expensive and address them. And we're doing that with the hard infrastructure, which is the roads, the rails, the power. And I think Dr. Teriba made that excellent point in his submission, that government spending on capital is not going to be enough. And we accept that. Our idea is to point the way, but we need to attract private investment in infrastructure, because that's what will bring down the cost of local production and make us more competitive.
That's the Minister of Finance, Mrs. Kemi Adeosun. Now, the Governor of Benue State, Samuel Otom, today called on medical doctors and health professionals in the diaspora to give back to their country, especially those in rural communities with difficult health issues. Mr. Otom made the call when he received the healthcare team of the Mutual Union of TIV in America at the Government House ahead of the 4-day medical outreach to 3 council areas of the state.
Begin to support us. We appreciate this. Healthcare services is one area that we have placed it top on our priority, and we having you to complement what we are doing is deeply appreciated, touching the lives directly. Doing this for quite some time. We appreciate you, extend our appreciation to Buta after the program, and I believe that it will add value to our people.
It is going to start today through Saturday, July 2nd, and in every health fair, the prevailing ailment has always been malaria, followed by heart disease, hypertension, and then we have some cases of diabetes, and then we have a few of cancer. But heart disease, diabetes, and malaria are always the 3 top each year.
Speaking earlier, Mr. Samuel Otom, the Governor of Benue State, now to a totally not unrelated issue. On the 7th of December 1987, the United Nations General Assembly decided to observe the 26th of June every year as the International Day Against Drug Abuse and Illicit Trafficking, as an expression of the determination to strengthen action and cooperation to achieve the goal of an international society free of drug abuse. Today, in line with the UN resolution, the Nigeria Drug Law Enforcement Agency and other stakeholders are marking this year's day with the theme Listen First. Listen First is an initiative to increase support for prevention of drug use that is based on science and is thus an effective investment in the well-being of children, the youth, their families, and their communities. The resolution recommended further action with regard to the report and conclusions of the 1987 International Conference on Drug Abuse and Illicit Trafficking. And now to take a practical look at the campaign against drug abuse and illicit trafficking and how to achieve this goal in Nigeria, I'm now joined on News Across Nigeria by Mr. Chudi Madibuna and Mrs. Ola Asags, both activists in the drug demand reduction. You're welcome to the program.
Thank you. Welcome, sir.
How bad is this situation in Nigeria as we speak? How bad is it? How bad is drug trafficking in Nigeria, Mr. Madibuna?
Trafficking or abuse? But
trafficking. Let's go with trafficking.
Trafficking, it's quite bad. It's because most youngsters now are getting into it, and you find out that what happens is that people who don't know about trafficking get into it, or knowingly they are being lured into it, and it's getting rampant. You see that every day people are being caught at the airport, coming in and going out. There's always a clampdown on traffickers.
Okay, Mrs. Asags, what's the pull for these young people that Mr. Madibuna just talked about? How much of it is blamed on societal pressure, economic pressure, and even peer pressure?
I think I could say 50-50. There's the peer pressure, there's the societal pressure in terms of our internet and all stuff. What you're not telling them at home, they're seeing it on TV, they're hearing it on radio. They're doing stuff, Googling everything. They want to know everything. They want to see everything. So I could say societal is also there, and it's even huge.
Okay.
And then also the family, the parents are usually not there. They don't know what their children are doing. Talking about even our Lagos that we are now, yes, because of people going to work and coming back late. You go to work.
How big, sorry to interrupt you, how big of a number are those who succumb to drug use because of peer pressure? Is it a significant number? We're talking about social use of drugs that leads to addiction. So is that a huge number?
Yes, it's increasing by the day, even among the students. It's now even going to secondary schools and primary schools. I've met 9-year-old, I've met 8-year-old who is into drugs. So the kind of drugs they take now is not, they can take it inside your sitting room without you knowing.
Okay, let's pause on this discussion. Let's take a break and we'll come back. You're watching News Across Nigeria. We're going to do just that. And when we do come back, World Drugs Day was yesterday. It's marked in Nigeria today. Stay with us.